Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about urinary incontinence, the involuntary leakage of urine. It may sound like a small problem, but it affects millions of people, often silently. It can limit social life, reduce confidence, and affect quality of life at any age. To help us understand what it is, why it happens, and the full range of treatments, including some exciting regenerative therapies, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine, is here with me. Well, doctor, what exactly is urinary incontinence?
Well, thank you for having me. What that is, it means the leakage of the urine when you don't want it to. Main types are stress incontinence, leakage when coughing, sneezing, or pressure, like from exercise. Urge incontinence, a sudden overwhelming need to go, followed by leakage. Mixed when you have both the stress and the urge. And the overflow or functional incontinence, that's less common and it's linked to bladder underactivity, obstruction, or difficulty reaching the toilet on time. It's very common, especially in women after childbirth and older adults, and it affects men, especially after prostate surgery.
What are the genetics that play a role in the development of incontinence?
Well, twin studies show that the urge and the mixed incontinence have strong genetic influence, often in the 40 to 50%. Family patterns are also seen in bedwetting, nocturnal enuresis, and daytime leakage in children. Genes that affect connective tissue and bladder signaling may increase risk. Stress incontinence, however, is more strongly tied to environmental factors like childbirth, though genes may still contribute in older age.
Can all of this develop embryologically?
Absolutely. The bladder, urethra, and pelvic floor develop from the mesoderm early in life. Variations in pelvic structure or connective tissue can lead people to incontinence. For example, women with weaker connective tissue or narrow pelvic shapes may be more vulnerable during childbirth. Pregnancy and delivery then magnify those underlying vulnerabilities, so embryology and obstetrics often intersect here.
How does traditional Chinese medicine look at urinary incontinence?
What TCM looks at incontinence is it's a weakness in the kidney key and the spleen key, meaning the bladder is described as an official water storage, and when this energy is weak, control is lost. So herbal formulas often strengthen key and have shown improvements in stress incontinence. Acupuncture and moxibustion can improve bladder control by regulating nerve pathways.
What is moxibustion?
Moxibustion is traditional Chinese medicine, utilize warmth, burning dry moxa. It involves generating heat and stimulating blood flow out of the area to balance those energy flows. And it sucks out the impurities.
All right. So, how do you diagnose urinary incontinence in your office?
It starts with a careful history. When leakage happens, what triggers it, and whether there are other symptoms like urge, stress, or pain, they're all important. So you end up getting a bladder diary that helps track the patterns. Urinalysis is used to rule out infection and is done on most subsequent visits to see it's improving. Physical exam may reveal a pelvic floor weakness or prolapse, which is why you get it into the correct pelvic floor therapist. And the post-void residual testing checks for incomplete emptying. That's best done on an ultrasound. In complex cases, urodynamics or cystoscopy is used.
All right. Standard of care for urinary incontinence.
We use a stepwise approach: lifestyle changes, fluid management, avoiding bladder irritants. Pelvic floor muscle training, Kegels, for example, tighten and release, first line for stress and mixed incontinence. Without a doubt, they help. Bladder training and scheduled voiding for urge incontinence is another very necessary addition. Medications for urge incontinence, antimuscarinics, or beta-3 agonists. Vaginal estrogen cream for the women, especially those with atrophy. Procedures and surgery may also be used, but are often done very carefully.
And now the regenerative medicine that you do in your office.
We are very fortunate because we use PRP, platelet-rich plasma. It's injected around the urethral sphincters or at the anterior vaginal wall. Studies show can improve incontinence and boosting muscle bulk, nerve repair, and blood flow. The results are especially encouraging for women with stress incontinence and men after prostate surgery. We have at least 50% improvement because we track it, like I said, as they come in the door. The exosomes are another. Remember, these are the teeny vesicles released by cells that promote healing. They find all the nooks and crannies and start healing those. Preclinical research shows that to support muscle regeneration, the nerve repair, that's a big deal, also reduces the fibrosis, which is scarring. Human trials are still early, but they hold exciting potential because they work. Both approaches are still experimental, but safe and biological promising.
All right, let's talk about lifestyle. What should a person do if they are trapped in urinary incontinence?
That would be a definite stimuli to get bladder training and urgency suppression. Urgency suppression often can be done with some minor medications. Kegel exercises multiple times during the day, ideally with biofeedback. You want to avoid bladder irritants, as we discussed above, caffeine and alcohol, booze, and some artificial sweeteners. Weight loss is very helpful. Even 5 to 10% reduces the leakage. Bowel regulation prevent constipation to reduce the pressure on the wall. Quit holding it. Quit holding that. If it's time to go, do so as fast as you can. You need to quit smoking, less coughing and less irritation, and practical adjustments like night lights, accessible toilets, absorbent products, or pessaries can greatly improve quality of life.
And the long-term outlook?
Most patients improve. In fact, some of them significantly with conservative strategies. It's being aware of it and listening to your body, even if it means getting up a little more often from your desk at work. Stress incontinence often responds very well to pelvic floor therapists and training to avoid the surgical repair, while urge incontinence may require ongoing medications or the procedures. Men after prostate surgery usually regain control within a year, though some need surgical devices. Prognosis is poor when radiation is used, which is probably true in most things in the body, but that's because it changes the blood supply as well as the strength of those muscles. So you're weakening the muscles, you're decreasing the blood supply so they can't heal, and then you impact the neurological damage, and that is sort of a triple whammy. So prognosis is poor if you've had radiation. Overall, with early recognition, individualized treatment, and follow-up, many patients can regain the confidence and control.
And your mnemonic for urinary incontinence?
Yeah, this one's sort of funny. It's LEAK.
L stands for?
The lifestyle changes. First, bladder training, Kegels, and weight loss.
E?
Evaluate cause, stress, urge, mixed, and overflow is functional.
A?
Advanced options, meds. And interesting is we use Botox too because it paralyzes the nerves. Slings are being more and more common because they are not as invasive. And it's sort of like putting in suspenders. Or you can use neuromodulation, and that stimulation is done on the sides so that, again, doesn't have to be done invasively.
Okay.
Just keep exploring new therapies. PRP, exosomes, and regenerative therapy are all working in our office.
Well, thank you, Dr. Henderson, for helping us understand urinary incontinence, a condition that is common, often hidden, but very treatable. If you or someone you know struggles with bladder leakage, remember, you are not alone, and there are many options available, from simple lifestyle steps to advanced therapies. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.